So today we're going to be talking about the RICE test. Now the RICE test is a test I use for patients at home to determine what breast size you're looking for with breast augmentation. I have a lot of patients who can't come into the office for one reason or another to size the breast, or they have breast implants and they don't really know what size they want to become. So what we use is this thing called the RICE test. So a lot of my patients have breast implants, but they don't know what size of an implant they have. It could be a large 800cc implant, as we have here on my far left, all the way down to 125cc implant. So there's a wide range of implant size. Also, patients may have had their implants placed years ago and they've lost breast tissue over time. So the majority of their breast, the percentage of their breast, becomes taken over more by the implant than their original breast size because they have lost breast tissue. So for the RICE test, you're going to need some supplies. As you can imagine, you're going to need some rice. So you can use any kind of rice you want. It doesn't have to be jasmine rice, but any kind of rice you want. You're going to need a handy dandy pair of scissors. You're going to need a pair of stockings, cheap stockings, whatever you want. You're going to need a sports bra, fairly tight sports bra, and you're going to need a measuring cup. It should have ideally cc's on the side, but if it doesn't have cc's, if it has ounces, I'll show you how to convert those. So what you want to do is you want to put on your bra. So you want to put your handy dandy bra on, and then what you want to do is you want to take your stockings, open up your stockings, and what you're going to do is you're going to take the foot area of the stockings and just kind of measure it up. I would cut it fairly high up. You could even leave the entirety of the leg like that. Just for tying purposes, I'm not going to cut this, I'm just going to leave it long. So what you want to do is take your graduated measuring cup and just fill up the stocking. So for this exercise, we're going to use about that much, all right? And you know, if you want to measure it out, I'd measure it out before you even start. If you look at the side thing here, this is 400 cc's. Or if you flip to the other side, you know, it's 14 ounces. So if you use ounces or cups or whatever, there are easy conversion sites on your phone or on the computer which will convert ounces or cups to cc's. So then what you want to do is you want to pour, in this case we're doing 400 cc's, and you want to pour that into the stocking, like so. And then what you want to do is you want to bring that sort of flat like that and then tie that off. So then you want to insert that into the bra, and that is about 400 cc's, or that is almost exactly 400 cc's. Then I would take the other stocking and go look at the breast and say, oh, okay, I want to go bigger or I want to go smaller, and adjust accordingly. If you want to go a little bit bigger, then say, okay, I'm going to use more than that 2 cups or that 400 cc's, and use that. And then in this case, we're going to fill it up to 500 cc's, or in this case, 2 1/3 cups. So we're going to put that in the stocking. Okay. And let's just go a little bit overboard. Let's bring it up to, I'm adding another cup, and in this case that's about 250 cc's. So this is 750 cc's now. So then we just plop that down into the sock area, make that pretty flat in here, and then tie it off like that, and then put it on the side. So for me, I think that's way too big on this side, and I think something in the middle of these two sizes would be appropriate. So this is about a 750 cc implant on this side. There's about 450 cc implant on this side. So then what you want to do is you want to adjust accordingly. If this size is too big, you want to go smaller. If this size is too small, you want to go bigger, okay? So then what you do too, probably the easiest way to do it is to remember what you put in on this side. So on this side, I put in that amount, 750 cc's. So basically I'm going to empty the whole thing and start over and go, you know, I wonder what 600 cc's would look like. So again, take your magic handy dandy cup and put in about 600 cc's, so there's 300 cc's on that side, or about 1.25 cups. Okay, again, there are easy conversion sites all over the internet. Put that in the stocking. So that's 300. I want to go to 600, so we're going to put another 300 in there, shake it down a little bit, and put in another 300. So I put in 300 plus 300, that's 600 cc's. Put that down into the stocking, tie it off, and there now is a 600 cc implant, smaller than my previous implant size, and that's approaching maybe the size you want. So again, you can sort of titrate this. You can spend a significant amount of time getting very, very accurate numbers with this rice test. So you again need some rice, some stockings, a sports bra, and a measuring cup to determine exactly sort of the volume you're looking for. Again, I think this is a very good way to measure the implant size that you want at home. I always like to measure my patients in the office, but if we can't do that, or if you want to fine tune it a little bit more, this is a very accurate way to do it. So this is not exactly how your implants will look. Again, these implants are on top of my skin, they're just underneath the bra. So you'll have a skin envelope covering the implant. You'll also have a layer of thin fat also covering the implant. So the exact shape is not the issue here, it's the volume we're looking for. So bigger on this side, smaller on this side, but this is a pretty accurate way of determining the size implants you want, and this can be done in the comfort of your own home. So you can see on these implants, this is a silicone smooth-walled, high-profile implant, 550 cc's. And I carefully measured 550 cc's in this rice with a stocking implant, and you can see the volume is identical on these both sides. The profile is slightly different, but in terms of volume, they're very, very equal. So again, this measuring device of 550 cc's of silicone implant versus 550 cc's of rice is pretty accurate and pretty equal. So I'm going to put this side on my left, this implant, and I'm going to put this rice implant on this side. And I have no breast tissue, so these are going to be pretty equal on both sides. So you can see, pretty equal on both sides with the implants. 550 silicone, 550 rice.
Slow rotation.
Serious medical show. So thanks for watching. This is how we do the rice test. Again, if we can't see you in the office to measure you up, this is how we do a rice test at home. Thanks for watching. Please subscribe. We'll see you next time.